Good afternoon, sir. Good afternoon, everybody.
Yeah, good.
This is an initiative by Know Your Calling team. We are very pleased to have you to interview you. Uh,
Thank you.
so,
Thank you.
welcome, Dr.
Pleasure is.
Parth. Uh, Now, Dr. Parth is a cerebrovascular and cell-based neurosurgeon. He's doing his doctoral fellowship in cerebrovascular neurosurgery. He's completed his MCH in PGI-MER and MS and MBBS in Baroda College. Uh, he's always been a high rank holder. He's got into PG fellowship with All India rank 1, uh, and in PGIEMER, he got rank 4 in All India. In JIPMA, he ranked All India rank 6 that year, and he passed MS with rank 1. And in MBBS, his class rank was 11. We are very honored to take interview of such a high profile person. Can I start by asking you, how are you?
I'm fine. I'm fine, Neha. Just please tell me.
Okay,
Uh,
so
yeah,
how was your day, sir? How was how was your day in general? Like how
yeah.
does
It
every
was
day
good.
go?
It was
Or,
good. Today was a lighter day in our neurosurgeon's perspective. It was a round day, so there was no surgeries today. So it was a good day.
okay, sir.
Thank you.
And so generally, how are the
Pardon?
other days, like the hectic day? Today, you said today is a lighter day. So
Yeah.
how are the hectic days?
The on the hectic days we have our full-time neurosurgeries. So these are kind of they start to at 7:50 a.m. or 7:30 a.m. in the morning, and then we finish by 11 or 10 p.m. in the evening. So that is around a 15, 16 hours a day. And then after completing the surgeries, we usually go to ICUs, take the round, settle all the patients which we have operated in the morning, and then we come back to home and have a dinner by 11 or 12 in the late evening.
So how many days in a week is like this? This
So
hectic.
this is like around it's around kind of 4 days in a week is like this only. It's
Okay.
mostly like this only. We just have two spare days. One is today and one is an OPD day when we are
Oh,
seeing the OPD and we are not operating. Of course, if there are some patients have come in emergency and something is there, so then on OPD also we go and operate. So that is how it is.
and sir, your weekend, like Sunday, how will it be?
Neha, I have not had any weekend since last 4 years in neurosurgery. And I think before that also in general surgery, I had not enjoyed any weekend. So I think it's almost 10 years that I have not had any Sunday off or Saturday off.
So, should all the people who are interested in this branch be aware that they will hardly get any time?
Yeah, I mean, that is a part of this branch that you don't have any holidays. And it is the sincerity that this branch demands, neurosurgery.
Okay, sir. So, can you elaborate more about neurosurgery, like the branch, how it is, what it is?
Yeah, I would. Yeah, I can describe it. It's kind of it's a highly specialized branch, and it demands a lot of dedication and passion and time. So that is why the working hours are very long, and the you don't find time for your family quite often. Your family, your wife, or your brothers and sisters or parents might feel that you are so lost. Sometimes I talk with them, say at 3 days, 4 days. Also, my mother has not spoken to me since 3, 4 days. I am busy, busy, busy. So you feel. I mean, the branch requires a lot of passion and lot of dedication, and if you don't have that inclination before choosing it, then you should not choose it. Like, it is not kind of a branch that somebody could just take as in key, you're not getting plastic surgery, so let us take neurosurgery. like as it is. You cannot do that. You cannot do that. If you do that, you will get frustrated in 1 or 2 weeks only. So if only and only those people who are like, who have that kind of mental dedication that no, I want to be a neurosurgeon from the beginning, from the MBBS only, you need to train your mind that no, I want to be a neurosurgeon. I want to work, operate the finest and the most specialized skills on this planet, the brain, the most complex organ on this planet. So if you really want to do that, you need to like make a state of mind, and then you should choose the branch. So it is not like very routinely that one can choose it. Otherwise, he will get frustrated. That
Okay.
is the problem.
So can you tell us 2, 3 tips on how you trained yourself for this branch? Like now,
Actually,
earlier you said mental state, you should train yourself. How did you
yeah.
do?
So it is, see, the whichever branch you choose, the basic motto remains the same. Like we have seen in the movies also, the dialogues we have heard in our parents also, that you should do that work which gives you happiness. Okay, so that is same in everything. So if some other branch gives you happiness, you should do that branch. That is the game. So if you feel that neurosurgery gives you happiness over a period of time, like you feel that being a neurosurgeon you will enjoy more, you will be dealing with the most complex problems in the world, and the finest surgical skills you need to have. There is a 2 millimeter gap or a 1 millimeter gap between a tumor and artery or a nerve. And if you are like not precise, you will cut the nerve and the patient is blind forever. So it is that kind of precision, and to gain that precision, a lot of dedication is there. So that is how I trained myself. That because I was initially, before only, I was very much inclined that I want to be a neurosurgeon, I want to pursue neurosurgery. So in my undergraduate also, in MBBS ward postings also, I used to go to neurosurgery OTs. I used to see, I used to do some night duties also, when we all know that MBBS students are not given night duties. But no, I would do night duties in trauma center. I would do go to some OT, watch 1 or 2 neurosurgeries, and then go back home and sleep. So I was that passionate. So one has to be passionate. You cannot be a non-passionate neurosurgeon. There are no neurosurgeons like that. It is that.
Okay, sir. So right now you said you could just be 1 millimeter away and make the patient blind forever. So
Yes.
I've heard that in neurosurgery, after all this effort, the outcome of patient is less convincing, or
Yes.
like it gives us less
Yes.
happiness. So how do you
Yes.
keep rewarding yourself? How do you look at a patient and
See,
say,
yes, actually, I don't keep rewarding to myself. Actually, it's a very sad part, and I'll tell you a very little and very interesting story in a very brief thing. Dr. Harvey Cushing. Dr. Harvey Cushing is the father of neurosurgery. So
"Hmm,
he was the person who started doing neurosurgery, and he was trained under William Halsted. So William Halsted is the father of general surgery. Like he was a general surgeon. He used to do all kind of surgery and everything. And this young fellow, this Harvey Cushing, is like a 22, 25-year-old male. He comes to William Halsted and says that, sir, I want to do neurosurgery. At that time, no neurosurgeon was there in the world, and he said that I want to do neurosurgery. So Dr. Harvey Cushing and there was this another fellow known as William Osler. Have you heard about William Osler? Yes.
yes, sir.
So they both were in the same college in John Hopkins Institute in USA. So both were together and they were friends. William Halsted and William Osler. Both were very good friends. They were like professors. And this young chap, Harvey Cushing, he came to William Halsted that I want to learn neurosurgery and practice. So William Halsted say that you are entering that dark room where there will be lot of pain, suffering. You will see a lot of people crying, hating you, and it is the most difficult and the most complex parts of the world. And don't do that because you will never get reward. And still, Dr. Harvey Cushing said that no, I want to do it, and he did it. So And you might be knowing that he operated the first brain tumor in a male. And he was it is also a very, very interesting story, but I think the time might not permit. But if you want, I can tell that in a very brief time.
Yes.
uh, yeah, there was a like there was World War II going on in USA. So what happened is there was a general of army major general of the World War, who was like he who fought the world war in behalf of USA. So he was very famous, very, very famous in the whole USA. And he was so respected that જે જગ્યાએથી એ નીકળે, lot of people will respect him, like everybody would side down, corner down, like that. Army general, this army general, he became unconscious and had one seizure. So the moment he became unconscious and everything, he came here to neurologist, and there were a lot of investigation, and ultimately it was diagnosed that he had a brain tumor. And then he searching ke who kon operate kari aapse brain tumor, because nobody was practicing neurosurgery at that time. He came to Harvey Cushing. Now this Harvey Cushing like was a very young fellow, and he's done like basic only holes in the brain, and like no, there were no instruments at that time. Na, there are no cautery ke brain mathi bleeding થાય તો you cannot stop it also. They don't have any mechanism to operate. Okay, no instruments, no backup, no OT backup. Okay,
Okay.
they were doing only minor surgeries, like they were like haddi upadvi ne. They are like very basic stage of neurosurgery. Now this guy, he comes to meet Harvey Cushing, that I have a brain tumor, and there is only one person that you can operate on me. So everyone in the John Hopkins Institute ના ખબર ટૂંકમાં કોઈ આટલો મોટો માણસ આપણી હોસ્પિટલમાં આવ્યો એટલે બધી જગ્યાએ એમ ખબર ફેલાઈ જાય આગની જેમ કે ભાઈ આ જર્નલ આયા છે એમ, અને એમને કંઈક પ્રોબ્લેમ છે, અને હાર્વી કુશિંગ ને શોધે છે એમ, sort of. So everybody was like, when they found out કે આવું છે, Harvey Cushing is like, he's બધું જોઈને he is like, sir, I can try. I have never done it. I don't know what will happen, but if you want, I can try. તમે ઘરે જાઓ, વિચારો, આમાં તમે મરી બી શકો છો, you can die, but I can try. Journal is like, no, કરી નાખો આપણે જે થાય, અને whatever I am daring. But journal's family માં એની wife, એની daughter, they are not willing કે ના નથી કરાવવું ઓપરેશન, કોઈને આવડતું નથી ને ભરાઈ જશું આપણે એમ. And then William Osler and William Halstead and everyone in the department, the senior professors, they also come to Cushing. કે Cushing, આ કેસ હાથમાં ના લેતો. If you do it and this patient dies, આટલો મોટો માણસ, અમેરિકાનો આટલો મોટો જનરલ આપણી હોસ્પિટલમાં મરી જાય, આપણું નામ ખરાબ થાય, આપણી બધી ઇમેજ ખરાબ થઈ જાય. Still Cushing takes the case. He takes the case. Journal comes. He opens the brain. Operation starts. The tumor starts bleeding. અને એ ટાઈમે જ્યારે એનેસ્થેશિયા જ નતું, ત્યાં કોઈ એનેસ્થેશિયા વાળો હતો જ નહીં એ ટાઈમે, એનેસ્થેશિયાનું મશીન બી નતું, કશું જ નતું. સો દે આર લાઈક ઈથર સુંગાડે, એમને બેભાન કરે, મોઢામાં ઓક્સિજનનું માસ્ક મૂકે, અને એક જણો પલ્સ ઉપર હાથ રાખે, બસ એટલું જ મોનિટરિંગ, કે પલ્સ ઉપર હાથ રાખીને ચેક કરે કે પલ્સ છે કે નહીં, કેટલું. That was the type of anesthesia it was used. And he started removing the tumor, and tumor started bleeding like hell. 1 liter, 2 liter blood lost.
Oh.
And Harvey Cushing was like, I have to stop, કારણ કે પલ્સ ફીબલ થઈ ગયો, પલ્સ ફીલ જ ના થાય. And Harvey Cushing like બધા ગોસ પેક્સ ને જે બી હતા ને એને બ્રેન ની અંદર ઠૂસી દીધા, અને he stopped the surgery. અને એને ક્યાંકથી બ્લડ અરેન્જ કરીને એને, એ ટાઈમે તો બ્લડ બી કેવું હતું કે ડાયરેક્ટ પેશન્ટ ટુ પેશન્ટ જ ચડાવે એમ, એટલે ડોનર ટુ ડોનર જ સીધું જાય એમ, એવું. પેલા બ્લડની બેગ્સ બી નથી, તો he transfused the blood, એવું. પેશન્ટ તો શોકમાં જતું રહ્યું, એકદમ હાઇપોટેન્શન, એકદમ કોલેપ્સ્ડ ઓલમોસ્ટ. But he saved the patient somehow. Tumor તો નીકળ્યું નહીં એનાથી, બરાબર. He used some bipolar ને એવું, and then he packed up the brain and everything, and somehow patient બચી ગયું. Next day, that day Harvey Cushing went to the John Hopkins ના ગાર્ડનમાં બેઠો. He was sitting in the bench, depressed, કે I could not remove it, અને હું ફેલ થઈ ગયો ને, sort of ને, he was very sad, એવું. Luckily, નેક્સ્ટ ડે મોર્નિંગ પેશન્ટ તો કોન્શિયસ થઈ ગયું, ટ્યુમર તો નતું નીકળ્યું, પેશન્ટ તો કોન્શિયસ થઈ ગયું લકીલી. બટ ધેન હાર્વી કુશિંગ વોઝ થિંકિંગ ઇન હિઝ માઇન્ડ કે હું જ્યારે રિમૂવ કરતો હતો તો અંદરનું ટ્યુમર વાસ્ક્યુલર નતું, ઉપરનું વાસ્ક્યુલર હતું, જેને મેં જલાઈ દીધું હતું, કાઢી નાખ્યું હતું એમ. સો હવેનું જે ટ્યુમર બચેલું હશે ને એ વાસ્ક્યુલર નહીં હોય તો કદાચ.
Repeat in English. Sorry
Yeah.
for the interruption.
Okay, I'm sorry. So Harvey Cushing was sitting in that desk, okay, and then he was thinking about the tumor, that why he failed. So then he thought that the tumor was vascular, but the blood vessel supply of the tumor was coming from above, downward. So I have removed that above part, the bleeding part. So the remaining tumor might not be vascular, so I can remove it. So then he again walks back to the general and says that, general, can you give me one more try? Okay, after 2 liters of blood loss, this much amount of problem, the general stands up and says, yes, you try once again. I am ready. I am a general of American Army. I will not refuse to war. I am not scared to death. Again, the general's wife and daughter, they started crying. No, you don't listen to us, and you always don't listen to us. We don't want to risk you anymore. You have already, God's grace, you are alive, and all those things. No? But general said, no, it is my body. I give the permission to Dr. Harvey Cushing. Please operate. And Harvey Cushing said that, sir, give me one try. I will remove the tumor permanently from your brain. I will make you tumor free for the rest of your life. He agreed. The next day, they all prepared and the operation started again. Now he removed all the bandage and everything, and he removed all the gauzes that he has packed previously, and he saw the tumor. The tumor was lying dead, and there was no blood vessel vascularity, and he removed the tumor completely, and the journal was all right.
So it's a branch that requires a lot of creative thinking also.
Yes, it requires creative thinking. And the most important message that I want to convey, 2 points. The next day morning, all newspapers in USA had a photo of Harvey Cushing and the general, that the first person to remove a brain tumor from army general's head was Harvey Cushing. So it requires a lot of daring because he dared to do it. It requires a lot of positive attitude because he did not get depressed despite of all the bad scenarios and everything chatter pitter around the hospital. So a lot of daring, lot of positive attitude, dedication, and a creative thinking.
Thank you, sir, for the story. From your, the way you're explaining itself explains how passionate you are about the subject. So we are getting a better grip on what we are expected to do when we come and join this branch.
Yes.
Sir, I want to know that now in MBBS, how did you, now you told you prepared doing extra duties and all that. Now, how did you know this is what you have to do? Like, how would you guide some other students? In final year, do they prepare for this? Or should they be focused on getting a PG? Should they be focused on, like, how
Yes.
should they distribute it?
See, I would not current scenario for getting a PG is very tough. So I would say that initially you should first decide you want a surgical branch or a non-surgical branch. That is the broad spectrum. If you decide that you want a surgical branch, then when you enter in the surgery, you should go to a place where you get rotation in neurosurgery also, plastic surgery also, all rotation. So you will get to expose what kind of surgeries you will perform. Then you will get interest in that branch and you will know how the way it is. This is one way and very methodical way. But there is also another side. Like there are students who always want to deal with brain. Always in MBBS also they are inclined towards neurosurgery. They like neurosurgeon as a profession because it is today till date it is the world's toughest profession. There is no doubt about it. So some people, they want this toughness and that thrill in the life. So they can directly go off. Otherwise, you can choose gradually after taking your PG and then you can go ahead.
Okay, sir. So now there's an option to do a neurosurgery directly instead of doing general surgery, then super specialization. So,
Yes.
can you elaborate the difference between the both?
Yes, I think, this has a lot of debate that it's a 6 year course versus a 3 year course. And recently, in the Chennai meeting of young neurosurgeon, which Dr. Derya also attended, this was a debate. But both the things are good. Both have their pros and cons. Like, say, if you are doing a 3 year neurosurgery followed by 3 year PG and 3 year neurosurgery. So in that, the benefits are you will get to know the basics of general surgery, how to manage the wound infections, how to manage the ICU, and everything in your general surgery perspective. Basics fundas will be clear, and then
Okay.
you are going to neurosurgery. But the cons are the disadvantages that 3 year period in neurosurgery is little less. You need more and more training because now today neurosurgery is also very evolving branch. Like there are a lot of subspecialties in neurosurgery. Like you initially briefed in my CV that I am a cerebrovascular neurosurgeon,
Yes,
a
sir.
skull based neurosurgeon. So that are like cerebrovascular, skull based, spine neurosurgery, functional neurosurgery. There are a lot of things. So in 3 year course, it is very difficult to get a very good grip of all these specialty. So you get less time in neurosurgery. That is the disadvantage. Like if you join a 6 year course, okay. So the problem is you will not see general surgery at all. So your basic funda, what is a wound, what is an ulcer, how the ulcer will heal, how a wound will heal, how to manage a basic ICU ventilator patient. Okay, that you will not learn quite good. But the good part is the neurosurgery you will learn very thoroughly because 6 year is a good time to learn neurosurgery. That is
Okay.
the best part. So if you are like clear from before, from MBBS only, that you want to do neurosurgery only, then only you should choose 6 year. Because the problem is, say if you are not clear and you have taken a 6 year course, after 2 years you say that you are not enjoying neurosurgery.
Okay,
Okay,
sir.
so you are not able to work for 16 hours a day, or you feel depressed like you have operated one patient and patient expires the next day morning. You operated 12 hours whole day and patient expired. You feel so sad, you feel so depressed, you feel that I don't want to be in this branch where there is no credit. So if you're not that much motivated and passionate, you should not join 6 year course. Okay,
Oh,
but 6 year has benefit because you get a very good exposure of neurosurgery. 6 year is a very good time. So subspecialty exposure also you get it. That
okay,
is
sir.
my
Now, sir, how about the settlement time, like the salary and things like that?
see. Salary and everything they are currently very local city based. They vary. Settlement time is a very is slightly long. uh, Neurosurgeons, that is also depends on the work that you want to do. Like see, if you want to do basic work only like trauma, if somebody coming with head injury or road traffic accident cases, the basic type of neurosurgery, then there is always demand. All over India there is demand because there are a lot of accidents and everything is happening all around. So if you want to do basic work, the settlement time is less. Like if the basic work is more, like if you want to do advanced work, like some high end work like cerebrovascular or some skull base, like everything, then the settlement time is more because gradually people will refer cases to you, you will get cases and you will grow in the market. So it will take 2 years, 3 years, maybe 5 years also to gain name in the good work. Okay.
So the more you super specialize, the more difficult it is to settle.
Yeah, yeah. It is like that. But then once you settle down, then you have a very good identity because you will be the only person dealing with such complex problems. Nobody else can touch it. So it is either way, na. So the more struggle you have, the more name and fame also you will have.
Okay.
That is the game.
Oh,
Catch.
okay,
Okay.
sir. Now, sir, how about while you're doing residency? How did that feel? And when you joined neurosurgery, what was the most unexpected things you went through? Like you didn't
Like,
know at all, and you would like to tell the next generation that this is a warning. Maybe you should think about this before joining.
see, first thing is the to the younger generation, I would just say that uh, if you enter the neurosurgery, what you have to carve and learn is dedication. That is the only thing that you need to have. Like operating 14 hours a day, and after that surgery also you are going to ICU and taking the round of all the patient that you have operated. That is dedication, because in human nature everyone feels tired. I also feel tired, you also feel tired. So it is a human nature, but you have to train your mind that no, I need to see my patients whether they are well or not, and then go. So that is the kind that training you will need to inculcate. That will take years, like 3 years, 2 years, 4 years. That one thing. And second thing, to the young people, that I would say is, uh, always be honest to you yourself inside and to your patient. Both the things, this honesty is very important in neurosurgery. Like if you have done some mistake, some complication, some injury is occurred in the brain by you, okay, always analyze that thing, that you have done this complication, this is by me. Lot of surgeons, they have that kind of ego. In general surgery they have learned that ego, seen someone else, that no, it is not because of me, it is because of something else, some other factor. No, it sister got some hand in between, so I caught that nerve. So you need to analyze that thing, that this is my problem and I need to improve it. That is self conscious. That is very important for a neurosurgeon. And you should tell the relative also that this complication occurred in the surgery and we are trying to manage it, but somehow we might fail also, and the patient might die also, and this is the truth. Because this habit you have to have in the 4 years of training. If you don't have this attitude or this habit of telling the truth to the attendant, you go out in the market, you will tell lie only, and that will not make you a very good doctor or ethical doctor.
Okay, sir. So now, how about family, personal life? How do you keep time away for it? Is it possible at all?
Initial phases when you are training, it is not possible to spare family time. I feel so. It is impossible. Like if you are able to spare Sundays and everything for family, that means you are not doing neurosurgery. It is like that only. That's straight. So you don't there. Initially, after settling in the market or working some for some time, you can spare time. That is not a problem. Once you are settled in the market for 1 or 2 years, then you can spare easily. You have money also, and you have time also for your family. So you need to have a life partner. You need to choose a life partner who is very understanding. Like sometimes you don't call her the whole day. I don't call my wife for 14 hours, like 16 hours, 20 hours, 1 day, 2 day. But it's okay. She understands that I'm working somewhere. So that
Oh,
understanding you need to have.
okay, sir. So now, is there any bias in this, like female, male bias?
There is slightly, because most of the neurosurgeons are males only. So there is a female bias, and there it does exist. I will not, to say very honestly and truthfully, I will not deny it. It does exist, because female neurosurgeons, whenever they join, and like nah, because there are like 30 male people and there is only one female or two female. So there is always some that kind of biased. So that
Oh,
is always there. But one thing that I would tell to the female audience who are interested in neurosurgery, that see, if you are good in your work, sincere in your work, ethical, and you listen to your seniors by heart, whatever they say, you do all the orders and everything and run for your patient, everybody will respect you, and then there is no bias. Everybody will teach you, and you will be a great successful neurosurgeon. So it is not like that.
okay, sir. So now, I saw in your CV that you're interested in research also.
Yeah.
So how do you take it parallelly? Is it must to be interested in research if you're becoming a neurosurgeon?
No, it's not must, ma'am. It's not must. It's because I was in PGI. It's a research institute, and we usually write a lot. We see a quite difficult cases, so we report also. So, but it's not very mandatory. But yes, I would advise to every other specialty also, not only neurosurgeons, that if you are a neurosurgeon working at anywhere, like in private also, like anywhere, and if you find something interesting, like if your surgery technique is something different from others, you should always write and
Okay, sir.
publish about it.
Okay, sir. So now, what about AI and all that? Do you think it's going to come up and the significance of neurosurgeon is going to go down?
It can never go down with AI.
Okay, sir.
There is no
So,
programming. There is no programming thing in neurosurgery. There is no robotic thing in neurosurgery because everything is like 1 millimeter precision and completely based on surgeon's judgment. Everything
okay,
is surgeon's judgment. So it's not like robot doing some steps in the surgery and everything. It's not possible. It's not possible.
okay, sir. Uh, sir, then what are the disadvantage of being in the batch? I mean, in the branch.
I don't feel any disadvantage. There are no disadvantage in this branch. If you like it, you enjoy it, you do it. The only limiting factor that I would say is if you want to do good, specialized, and skilled neurosurgery, you need to have good setup like microscopes, endoscopes, all equipments. You need to have good equipments so that you can do very good work. Like I have done all sorts of like microscopic surgeries and aneurysms and everything, very difficult cases. And also from the endoscope, from the nose we remove the tumor of the brain without any incision on the head. The tumor goes off from the nose only. So we need highly specialized equipments to do all these things. Like if you are a we are a, like if we are a middle class person, we are starting our practice somewhere, so we cannot have all those instruments directly. Like these microscopes, they cost 2 crores, 3 crores. Like these endoscopes, they will also close in lakhs of rupees. So how to arrange all this setup, that is the most difficult part that I feel a limitation in neurosurgery. And second thing is ICU backup, because all patients in neurosurgery 50% are in coma. Either they come in coma or after surgery they are in coma for some time. So you need a very good ICU backup so that the patient is managed in the ICU and the patient gets out of this ICU. And we
Okay.
can, so these two problems we have in the initial part of the career, because we cannot afford to have the whole ICU ventilator and everything, no, when we are starting the practice. So this is the issue. Otherwise, there are no other issues.
Okay, sir. Sir, now any special messages to the KYC group?
Yes, the only special message is that neurosurgery is a wonderful branch and it's a highly skilled branch. It's a highly skilled branch. There are no other branches which has this much amount of skill requirement. So if you have the finest of the skill with 1 millimeter precision in the brain, then you should pursue it. Second thing, you should always be dedicated and passionate for the neurosurgery. Always be passionate. Don't take it if someone else is telling you that take this branch, it's good, there is money and everything. Don't take it. If you like it, then only take it. And yes, you should have a very understanding family support for this branch if you want to take it.
Okay, sir. Sir, can you freelance in neurosurgery? The
Yes,
difficult.
yes, you can freelance, but the problem again come that you cannot freelance it everywhere like everyone does. You need to have a good setup and ICU backup to freelance. Like you cannot go to some village and do neurosurgery. No, because then your patient will die. There is nobody to manage it. So you need to have some good enough amount of medium type hospital and everything.
So do we have patients of our own, or is it more of reference patient neurosurgery?
Uh, Basic neurosurgery patients we can get directly also, and the advanced neurosurgery like some brain tumor or some problems like that, you get referral patients only, because they initially go to physician or neurologist for a headache or some seizure or some problem that they have, so then they will refer it to you. But
Oh,
basic like accident, if accident case comes, nobody would dare to keep the hand in. He will directly call a neurosurgeon, sir, please come. So
mm.
that that is the best part of the neurosurgery, that nobody, like if you are doing like a hernia can be done by a plastic surgeon, Like a plastic surgeon is free, he can do a hernia also. Okay. Like a gastro surgeon can do appendix also. Okay. But neurosurgery, nobody will dare. No plastic surgeon will say, no, no, I will do brain also. No, nobody would even open the brain. They're like scared of it. So that is the best part. No one can encroach on the branch.
Okay, sir. So once we are in the game, it's totally in our hands.
Yeah. Once you're in the game, it's in our hands. And once, if you are passionate, then you can drive it across all the fields.
Okay, sir. So, and what about college recommendations? Like how to choose a good college for yourself?
See, for MCH, I would, yes, this is a very important question. And see, MCH for neurosurgery, the best place where most surgical work is done is PGI, Chandigarh. There is no doubt. PGI, every year, 3,000 plus surgeries are done in neurosurgery. And you can see my CV also. I have done 550 neurosurgeries in last 1 year only.
Yes,
That is a
sir.
huge amount. So PGI is very good, and with this, academic is also there, teaching is also there, education is also there. It is not like just operate, and go. So it is not like that. They teach you. The professors will teach you everything. Second important institute is Nimhans. I feel it's a very good institute, only neuro oriented and very good work. Third thing I feel is Sri Chitra, sorry, Jipmar. Jipmar has very good work in neurosurgery. GB Pant has very good work in neurosurgery. And fourth is this Sri Chitra and AIMS Delhi. AIMS Delhi, I will keep slightly lower side because the surgical on hand work is less slightly. So you will not get hands on to operate much. But yes, the protocol based management in AIMS Delhi is the best all over India. So that is.
Okay, sir.
But I may be wrong somewhere. If somebody is from AIMS, he might not agree with me. Somebody is from Nimans or PGI, sorry, Jipmar, he might not agree with me. So there are like personal biases also. So I don't stamp any college. But yes, these are 6, 7 good places where you should learn neurosurgery. That is what I'm saying.
Okay, sir. So I think we can conclude the interview. Is
Yeah.
that all right with you, sir? So
Yeah.
thank you so much for spending so much of your time passionately explaining to all of us young kids how to choose neurosurgery and about the passion it requires. We are so glad. Thank you, Dr. Parth. I hope you
Thank you
have a
very much. Thank you very much. Thank you.
thank you, sir.